Hello, reviewer team. My name is Alton Johnson. Actually submitting my EPA 17, which is creating a learning plan. Um, Currently a podiatrist, podiatric surgeon in the Department of Orthopedics. This will actually be my first EPA submission, so please forgive me if I miss some of the elements, but I'll do my best to address it. So I based my plan off of the individual development plan that's used for the university. In this, so it also includes the work-life integration strategies. So it's a tool for planning, inspiring, and integrating my professional career, personal domains. Part one. So identify my values, passions, and visions for my professional career and personal life. So values, passions, visions, and leadership. So the values, what characteristics, qualities, beliefs are at the core of who I am and how I live. I would like to say enjoyment, enthusiasm, professionalism, commitment, and reliability. When I chose these five values, I wanted to encompass something that I thought would fully display who I am as a person, as a professional person, as a personal being, father, leader, doctor. So enjoyment, enthusiasm, professionalism, commitment, reliability is kind of my values. So top character strengths. So according to the VIA Institution, our Institute on Character Assessment survey that I took to address these uh, elements, I would call it. So it was kindness, humor, fairness, forgiveness, and humility, which I found very accurate. So which is why I decided to include this in the EPA. So according to the VIA Institution, I'll have our VIA Institution survey, character assessment survey. Kindness is something I value the highest, followed by humor, fairness, forgiveness, and humility. It's interesting when when I did this, I got feedback on from both my patients, some of my mentees, my mentors, and some of my colleagues, and even they all kind of agree that yeah, this is a pretty accurate description of myself for this particular top character strength. So passions, what are my professional passions? Education, hence why I decided to enlist into the MHE. Mentorship, scholarship. So mentorship, I don't want to glaze over that. So mentorship is me being the mentor as well as me receiving mentorship. Scholarship, publications, things like that. Educating young people my age, my career level, I should say, not age, but I mean because I'm a young podiatric physician. Um, Scholarship and networking. Love going to networking events. Actually, will be attending a conference at the end of this week. So excited about that. But those are what are my professional passions, sort of what drives this professional career that I have decided to develop. What causes motivate me to act? So helping others succeed and learn new skill sets or knowledge, making a resource to being a resource for others for guidance, which kind of alludes back to a previous slide discussing the mentorship aspects as well as scholarship. So that's kind of what motivates me, my passions or what I'm passionate about. When am I compelled to take a stand? So then inequities, bullying, harassment. Even most recently had a coworker of mine that was being bullied. Um, Really a lot of microaggressions, passive aggressive type of situation by another coworker regarding their being transgender. It just didn't settle right with me, and I was escalated that to the appropriate leadership. But it's just like those things are just something that work environment's already stressful. Should not have to deal with those type of elements in their work environment, and that's that. Barriers to success, so anything that's like stopping someone from being successful, no matter what the issue is, I definitely take a stand for that. It's not fair to when someone's doing their best and they are not able to receive the recognition or the accolade or the deed they're trying to accomplish. So definitely those are what compels me. So passions. When I'm enthusiastic about a project, when it has an impactful outcome. I'm currently working on several extended reality educational projects. Although neither are near completion, I'm always enthusiastic about working on the projects and speaking with others about the projects. I recently presented one of the projects at the Health Professions Education Day, and any project involving amputation prevention awareness, which is that. But yes, I do have several projects. One is an augmented reality project meant for educators and learners to learn how to do diabetic foot exams. And the other project is a virtual reality project that teaches the learners surgery. So it pre-records these virtual reality surgeries, which is live action, but they actually will have a headset on to um, go to pre-record mode and rewatch these surgeries as they need, and has different overlays for them to review for X-rays, vitals, surgical positioning, tools, different camera angles that they would need. They can go back and forth as needed. And I like the headset itself because it can be isolated and not have to be distracted. Just like that, I just got check on my phone, so you could have that no distractions. So any project involving amputation and prevention awareness. So I am a podiatrist, podiatric surgeon, wound care specialist. So anything dealing with peripheral arterial disease, diabetic neuropathy, that can help these patients keep their limbs. That's what I love to be a part of. That's the research that I put out as well. So that's what I work on. Those is my collaborators are in my network. It's mainly in that atmosphere. What vision can I imagine for my professional life and personal life in the future? I envision myself in a leadership role at a medical school in either the United States, Canada, Caribbean, or the continent of Africa, being over curriculum development or in a clinical dean role. Still envision myself in clinical practice at some capacity, but being a smaller portion of my role within the next 10 to 15 years. Oddly enough, just last week, I got approached with a medical school, podiatric medical school, that was had a dean vacancy, and my name got involved in there, and actually went through some of the beginning preliminary steps to interview for this particular role. Decided it wasn't a fit yet for my family, mainly due to geographical locations, and mainly because I also want to complete things such as the MHPE. Even I could do that while doing the dean, but I wanted to be very I already wanted to have that skill set brought to the table when I accepted a role like that, and they wanted to kind of half do it if I didn't think I could be successful in that role, given that there's a lot of people's futures riding on my success if I had accepted such a role at this stage of my career. But I was very appreciative of the to be able to even interview for that role, but decided to you know not proceed throughout the interviews. But that's the kind of role that I want, something where I'm helping develop curriculum, thinking of new curriculums, coming up with these innovative ideas, and and presenting those and executing those as well for my learners. So my personal life, I envision myself very involved in my children's lives with a flexible work schedule that allows me to attend key events. So will I be able to make every practice? No, but I would hope to be able to make every recital for those, or every basketball game, football game that my kids have. Quarterly couple getaways, biannual family vacations, and annual solo vacations to recharge mentally for myself, and also run a debt-free with financial securities. 'Cause that's my vision. Being, I didn't know exactly how much to get into it. I mean, I'll go into some of the leadership visions that I have later on in the slides, but that's sort of what I see myself. Just why I do what I do. One of the reasons, I should say. What do I want to accomplish? If I could be an example, no matter your background, your race, your sexual orientation, your gender, your sex, that you can succeed in your choice field or specialty, no matter what you're doing, that would feel as though I accomplished my goal. So if I could do that and be an example, a template for these future generations behind me, or even the ones that are in the same generation as me, then I feel like I have succeeded. And other career goals would be to contribute significant scientific and medical educational research to the field that would be impactful for generations to come. I'm very, truly passionate about the amputation prevention, so I could help reduce the rate of non-traumatic amputations. I would also feel accomplished, which is like I mentioned in my previous slides, of having these publications working with these networks, working in these organizations, taking committee roles in these organizations such as the American Diabetes Association, the Save a Leg, Save a Life Foundation. Those is what those are the elements that I'm trying to take and try to convey that, because it's a vision I have, but I need these conduits to get it done. Even vehicles such as this one, where it's like this is a self-learning track of, but I'm able to succeed it. So vision, who do I aspire to be? Alton Johnson as a person who cared and gave and get every in sorry, who who cared and gave every initiative and activity his all, whether it be teaching, leadership, mentorship, or caring for his patients. If that's what I want to be, it's not, that's what I do. It's like, this is why I do wake up every day. There's the saying with the Navy SEALs that, they go meal to meal. I go day to day. And this is what I'm doing day to day, trying to build on that teaching, build on that leadership, build on that mentorship, build on my patient clinical bedside manner, which, also my surgical skills that incorporate into that. But that's the situation that I'm in. So what do I envision my legacy to be? So previously alluded to that. I like my legacy to be an example that one man can make an impact and influence change that is permanent and positive. My legacy, I want it to be defined as a template to how to change the status quo by methodically making small steps towards a betterment each day, which equals a summation of a larger effect for all involved. My coworkers, my patients, my mentors, my mentees, my colleagues, my family, all of that, my friends. Leadership. So, what is leadership and vision? What is my leadership vision, conceptual design? At the moment, my leadership vision is one that's composed of a cognitive diversity, where I'm not the only thought leader making these decisions and suggestions and educational goals for the learners, but it's my vision and that other leaders at the table also contribute ideas and enhance this learning. I think that giving that I'm a podiatric medical physician and wound care specialist, is a growing field of focus that I'll be, but having an interdisciplinary collaboration, providing education, and having this fluid and cohesive nature of design for these specialties to thrive to help these individuals that are high need succeed, and also giving these individuals that want to learn how to address these high needs succeed. I think that's it. Like, that's the leadership. That's it. I don't, necessarily need to make the most gross income or something like that. It's just that is it. And if I've executed that, then I've done my job as a leader. So I'm the leader of the podiatric medicine and surgery subsection in the foot and ankle surgery department, or foot and ankle division within the Department of Orthopedic Surgery. So I started off as the only podiatrist in that department. Now I help recruit another podiatrist, a podiatric surgeon, to help me further develop it. And I go more so like my involving leadership vision that I have. So, at the moment we have two surgeons, podiatric surgeons within the division, four orthopedic surgeons within the division as well. Um, so my goal is to build a self-sustaining team of four podiatric surgeons. Currently, like I said, there's two, including myself. Like to have two more. So with using the SMART approach, so establish a formal Department of Podiatric Medicine and Surgery subsection within the orthopedic surgery department, within this foot and ankle division, to enhance patient care to integrate specialized podiatric surgery services. And then measure, well, by the end of the year, or this really fiscal year, not December, the fiscal year, be able to recruit and onboard at least two other podiatric surgeons. Even one I would be okay with, but what goals you got to be, aim high. So I said, let me just aim high. Set up a dedicated facilities with necessary equipment, materials, and to launch a comprehensive patient care program, aiming with 200 unique patient encounters to serve in the next 6 months. So this is also kind of how it goes. Because you have to, you're going to ask for something, you have to show the need, so be able to build that practice that's sustainable, to show why we need those other surgeons to help do it. So that's the goal. And then, actionable, so, to collaborate with the department leadership to identify the space and resources needed, secure the funding through the departmental budgets and grants, and leveraging existing networks to recruit qualified podiatrists in this role. Um, and then, of course, the goal is to sustain the overarching mission, of providing a comprehensive orthopedic care and addressing the increased demand for specialized podiatric surgeons. Target. So complete the established our time. I should sorry. I call it target or time date. Completing the establishment of the department within the 12 to 24 months, including the hiring process, setting up the facilities, and initiating patient care programs. That's the goal. I mean, that is it. That's my leadership current leadership situation. Kind of showed you my long term or like bigger vision, but this is like the one I can do now. Almost did the one that was kind of far away now, but that's how it goes. But so acknowledging my strengths and addressing my challenges. So this is done um, both internally and externally. So with some feedback of my supervisors and some of my mentors on this particular one, mentees, but mentors for this one, even my wife as well. So that's pretty cool. Yes. So my strengths, which I have identified, is resilience, acceptance of feedback, or accepts feedback well, compassionate, great listener, hardworking, lifelong learner, forward thinking / planner, and transformational leadership, which I think was conveyed in my story thus far, based on the slides that I've reviewed. So challenges for me, time management, you know. So it's like I always feel like there's never enough time. Like this EPA, I feel like it should have been done months ago, but my personal life and professional life very demanding. So it's like this is a passion of mine, and I want to be great at it. So I also have to allocate the time for it, just like going to the gym or something. So it's like uh, this, takes time to get to those stages and have to offload certain things to get to it. So that's one of my challenges still. But I've taken time management classes pretty much throughout my entire, would say life, but career, collegiate, starting in college, second, third year of college, took time management classes, took it in medical school, um, did a couple online courses through residency and fellowship, and even continue to take them now. So it's always I do different things, checklists, things like that, but still a struggle. Resilience. So it's like I call it a challenge because I never give up, and so it's like I am. I guess it probably should be stubborn, but that's what it. And frustration occurs when others are not passionate about my are compassionate. Not they're like, oh, I'm a podiatric surgeon and I want everyone to care about limb salvage. I mean, but I think if you are a podiatric surgeon or orthopedic surgeon, you especially in the lower extremity, you should care about limb salvage. So that's how I see it. Or if you're endocrinologist, you should care about preventing patients from getting diabetic neuropathy. If you're a primary care physician, you should be willing to educate your patients on PAD and diabetic neuropathy and diabetes. That's how I see it. But so when people kind of passive about it, does frustrate me because sometimes I end up in my office and I'm just like a simple referral could have changed certain things, outcomes for these patients. And so it kind of is frustrating on that end. Also, multitasking. I am guilty of multitasking. Not the best multitasker, but I've always done it. Other things I think other things I think I should live in the moment more and not always plan. That's true. Even like I said, recently had the situation with possibly, just interviewing for a dean role or something. It's like I really do enjoy what I'm doing now, but I'm always planning the next stage. Not great at relaxing or downtime. I would say since I created the slide, which is probably about a month ago, I have gotten a little bit better at that, taking more vacations, dedicated mental health time to recover from both my professional and personal demands. Declare my professional goals, short and long-term goals. Short-term goals. So this will be in the SMART, specific, measurable, actionable, reachable as well, and then time. Short-term goals are so relevant, not reachable, relevant, and time-bound. So given that I'm the first and only podiatric surgeon, when I wrote this, I was. Now I have another surgeon to help me in the orthopedic surgery department. My goal is to support the foot and ankle service chief and develop in a more robust podiatric surgical arm that is effective and beneficial to all teams involved in the lower extremity, especially the patient. So support and help build the podiatric arm of the podiatric surgery department, which I mentioned. We track every quarter, and these steps have been taken to achieve these goals, and then execute an initiative that sets forth by the foot and ankle service chief to ensure that we are progressing, such as assisting with grid development, inpatient, outpatient management algorithms for routing these patients. Feedback for the SFO, which is just short for the foot and ankle team, the medicine team, and the house officers involved. This will be done within the next academic year, which I have already started. So my short-term goals, I've already started achieving them. I have not accomplished it, but working towards achieving it. One of them. Other one is given that orthopedic surgery has embraced podiatric surgery department, I've noticed there's not adequate or formal podiatric services in pediatric populations in our healthcare system. It would be ideal to help build this initiative and allow our pediatric patients to have pediatric care that's equivocal to our podiatric services and or the orthopedic services for podopediatrics as well. So it's very specific. So integrative podopediatric clinical support, measurable is this can be measured by the progression initiatives that are where it'd be a half-day clinical session, mixture of video visits for these patient population or in-person visits. Execution of this initiative by having discussions with the orthopediatric service chief, their teams to see where they feel there's a deficit in podopediatric care. Mostly, I think it's in nail surgery, to create plans to fill these gaps. Feedback from the orthopedic peds team and also the patient population that we'll be serving. This can be done within the next academic year. Also working on that one as well. Did not have the dedicated clinical grids yet, but we did create a referral process for these high need patients that need pediatric services. So that also is a short-term goal that I have reachable. A 3 to 5 year goal. So promotion to clinical associate professor, working on my publications for that, working on cleaning up my CV to get that done. Subsection chief of podiatric surgery and medicine would be nice. Sometimes always good to have a title, so it should be translatable to future promotions or outside institutions. Because trying to explain this situation to a nice institution without a formal title is a little complicated. Then obtaining at least $500K in research grant funding. Just got notice that I possibly have $250K of grant funding coming within the next year from the NIH for a small business initiative research grant that I'm working on involving limb preservation. So offloaded diabetic foot wounds with an external brace. So also reaching that goal as well. 10 year goal be to be a full clinical professor, obtain at least $1 million plus in research grant funding, have more medical school, college leadership roles, a dean of some level offers are entertaining, or even the ones here at the university. Less clinical and surgical practice with a focus on education and administration. So right now I'm 36, thinking 45, 48. Trying to start achieving that particular 10 year goal. How am I planning to achieve these long-term goals? Completing this MHPE, attending conferences to network, identifying mentors that are a similar track, and joining committees, internal and external, which I have already started doing. Already was in a lot of external committees, but now starting more in my departmental committees, and will reach out to my institutional committees as I have more time. As mentioned, I already have time problems. Executing my time management skills. Speaking of time management skills, time management. Did I demonstrate a good time management skills the past year? Short answer is no. But I was also in a unique situation where I was switching departments, trying to build a new subsection within the department. Also being the only one that did what I did in my department to take care of my patients, build a grid, all of that kind of play a factor. Am I satisfied with how I allocated my time in terms of my professional, personal, and work life integration? I think in my professional life, I was just in survival mode, just trying to get through until now I have a backup partner that also does what I do in my specialty, which has helped a lot with my mental health, which is why I was able even to finally feel comfortable enough to sit down to complete my EPA finally after being registered for several semesters. But the situation was very novel for both parties, so I cannot blame anyone. So, personal life, I think I have better time management by spending quality time with my family, planned weekend activities, quarterly vacations. Recently took the family to Alaska, spent this weekend at a friend's house, at a house party. So it's great. So those is what I try to do for my family. So I think I am improved. What went well? The personal family side, I think, like I said, mentioned, but professional side, I survived enough to pitch getting a second podiatric surgeon to help with the cases and clinical load. That helped. So that's definitely a help. What suffered my mental health and burnout. It was very hard to me get motivated to complete the EPAs that I needed to get done, or even meet with my mentor for the program as well. So that was the issue. So that is starting to be resolved as well. The Masters of Health Professional Education goals that I had set. So that, yeah, that's suffered. Um, Time management. How can I improve a more rigid scheduling throughout the week? I already kind of live pretty rigid, but I guess I could be more stringent on it and have more boundaries of who am I interacting with, as in whether it's consulting or my because I also do consulting, or what organizations I get involved with and how much time commitment there is. Have more protected time, meaning more grant funding, so I don't have to be in clinic as much. That helps a lot as well for success of an academic career. Um, and like I don't have protected time to complete this program. So, do I need any resources or tool? Using my app, so I do use my administrative assistant more, and I think that has helped. Probably use her even more to do it. Split up the workload with my new partner, so I'm definitely doing that as I speak, just even as recent as today. Evaluation of my prior successes, disappointments, and revelations. So, which of my previous year's professional and personal goals did I meet, and what did I learn? So, like I said, this was a unique situation because this was my first year in a new department. So, professional wise, those goals had changed from the ones I had in the previous department because I didn't really have a goal. The goal was just survive. So, I didn't have any professional goals to set last year because I was in a transitional year. The personal goals that I met, both that I had set, to spend more time with my family and stay more active. I think I did that pretty well. And I realized that the time does not change how you view your approach. So adapting to any ever evolving situation will help you utilize the time that you have. So that's what I learned from it. I had to adapt and overcome these situations. What factors in this that feedback in that last going that factor was from my supervisor, my wife, and my kids. So that's kind of the feedback I got and how I received it. What factors, resources, the individual helped me reach those goals? So the biggest resources this year was my administrative assistant. She got me through, make sure I get these deadlines, make sure I write these letters, make sure I stay on top of my paying my tuition for the program that I didn't get to do some NEPAs or that type of stuff, the paperwork, the MOUs, MOUs and completing these grant deadlines, all of that. So the RISE program also, give kudos to Raj. I was actually with them this weekend. He helped, that program helped pay my clinical time on Mondays, which ended in January. But I was actually gracious, my department was gracious enough to give me about 3 to 4 months extension afterwards, sorry, which also helped, but didn't get to get as much stuff done as I wanted to. So personal goals, as I end this EPA, I hope I've hit every element. If not, I'll go back and do it. But I mentioned my feedback, mentioned what I learned from it, summarized it. So I hope that I have hit every mark that's needed. But pretty much personal goal wise is staying active, spending more time with my family at home, less work. This really is not work. This is enjoyment because I'm learning something that it's really a lot of reflection in MPAs like that. Golfing more, fishing more, and completing more EPAs for my master's of health profession education, so I can be more proficient and a better teacher, really, yeah, for my learners, and also better father, better doctor, better surgeon. Thank you for my EPA. Thank you, team, for reviewing this, and I appreciate your time.